Benazepril, drug overview. Generic name: Benazepril hydrochloride. Drug class: angiotensin-converting enzyme, ACE, inhibitor. Common brand names: Lotensin. Uses, indications. Benazepril is primarily used to treat high blood pressure, hypertension, reduce the risk of stroke, heart attack, and kidney damage, manage heart failure in some patients, protect kidney function in patients with diabetes or chronic kidney disease. Mechanism of action: Benazepril works by inhibiting the ACE enzyme, preventing the conversion of angiotensin I to angiotensin II, causing blood vessels to relax and widen, lowering blood pressure and improving blood flow, reducing the workload on the heart. Dosage forms and strengths: tablets, 5 mg, 10 mg, 20 mg, 40 mg. Dosage depends on patient condition, age, and kidney function. Administration: taken orally, once or twice daily. Can be taken with or without food. Dose adjustments may be required in renal impairment. Common side effects: dry, persistent cough, dizziness or lightheadedness, headache, fatigue, nausea. Serious side effects: angioedema, swelling of face, lips, tongue, throat, severe hypotension, hyperkalemia, high potassium levels, kidney function impairment. Contraindications: history of angioedema related to ACE inhibitors. Pregnancy can cause fetal harm. Hypersensitivity to Benazepril or other ACE inhibitors. Drug interactions: potassium supplements or potassium-sparing diuretics. NSAIDs may reduce antihypertensive effect. Diuretics may increase risk of low blood pressure. Lithium, increased toxicity risk. Use in special populations. Pregnancy, contraindicated crossmark. Breastfeeding, use with caution. Elderly, start with lower doses. Renal impairment, dose adjustment required. Storage: store at room temperature. Protect from moisture and heat. Keep out of reach of children.